Yeah, hello. Welcome to the Tulip Airway channel, video 30. In this video, we're talking about cuff inflation, pressures and volumes, how you can adapt the tulip to what you need, the right pressures for the right size, what to watch out for. Now, for tulip inflation, the most important thing is to use a 60 ml syringe. Okay, it's a very large cuff, and therefore basically the cuff itself is requiring 30, 40, 50 or 60 mils. So don't use a 20 ml syringe 3 times. You'll forget, the pressures won't be right, it won't sit right, all sorts of things. So we're going to go over the sizes and the inflation volumes, the sizes and inflation pressures, and the principle of fitment. So back to the first and most important point is use a 60 ml syringe, don't use a 20 ml 3 times. This is because the tulip is designed to inflate in one go, not 3 increments. So the sudden expansion of the cuff inside the oropharynx will actually fit perfectly rather than 1, 2, 3 and kind of moving from side to side, because we want the tulip cuff to be seated equally and centrally. They're not quite the same thing. So this is the chart that's included in every instruction for use in every tulip. It's also printed on the right size, the right volume and the right inflation pressures are printed on each and every tulip, and when you look at them they are actually exposed to you in the wrapping. But just to go through this, you will see that there's the inflation pressures, there's inflation volumes according to the appropriate sizes. So I went to go and see a friend of mine who's a consultant anaesthetist, somebody I trust and I've known for several decades, and she asked me a very important question. She said, what's the minimum inflation pressure in a tulip cuff? And I thought that was a very good question, because the recommended pressure is 40 millimeters of mercury, which is 50 centimeters of water, and that is the same as mucosal perfusion pressure, but it's also the minimum inflation pressure, because as a tulip inflates, I'm going to use the 60 ml syringe. As a tulip inflates, what happens? For the green one, the size is actually 50 mils, right? But as the cuff inflates inside the patient, anything less than 40 millimeters of mercury and 50 centimeters of water, that cuff will not be fully formed. All right. So if you use a pressure that's too low, you're going to have a cuff that's a bit baggy. It won't displace properly. So 50 centimeters of water, 40 millimeters of mercury is what fills a tulip cuff, and it also gives you a very good barrier for ventilation. I mean, you can achieve like 50 centimeters of water ventilation, and you just don't need that much. So a soft cuff, is perfectly possible in order to get what you want. So, as I said, 40 millimeters of mercury, 50 centimeters of water is mucosal perfusion pressure, which means the blood should still be flowing through the mucosa in the mouth and the oropharynx, and that's the softest known airway cuff. Now, every tulip has the various parameters printed on it. This camera is not particularly useful for this, and I've got photos of this, but on the tulips, every one of them is exposed to you like this in the packaging, as you can see. And what happens is that enables you to read what it is that you're supposed to do from the off, and that's basically pointing outwards. Now I'll tell you that, can't see that very well right now, but it's okay. So, but this is the important point, is don't underdo it. All right, below 40 millimeters of mercury, 50 centimeters of water, that cuff will not be fully formed. So the cuff won't be fully inflated. It won't fully displace the anatomy, so it won't give you a clear airway, and it won't seal against the side, so it may leak and not seal fully. So the process of insertion for tulip: insert, use the most of the flexible tube, inflate, ventilate, then secure. All right, don't put the headband on first, because then you're pushing it into a non-anatomical position as it inflates. So you put it in, let it seat itself anatomically, inflate in one go with a 60 ml syringe, then ventilate, then secure. All right. Now our tulips, basically, some of our tulips have headbands, like that one's got a headband in there. This one hasn't. That's designed kind of, more cheap and cheerful for Goodell use, just straightforward. These headband versions are much more for kind of starved elective anesthesia. There's a headband there, which you can see it. So there's an elastic headband there on with the lip guard. That's basically the long-term stability and start with elective anesthesia. So for tulip inflation, here's an early water I did about 20 years ago. But as you can see, the tulip is seated, touching the tip of the epiglottis there. All right, I'm going to try and use this pen thing. So as you can see, here's the tip of the epiglottis there. All right, so here's the trachea, here's the epiglottis, here, and that's supposed to be like the thyroid cartilage, but there's the tip of the epiglottis just bumping into the front of the tulip cuff. Now there's the tulip. Now there's tubes going in the mouth, between the lips, between the teeth, over the tongue, soft palate, and then it's going through the posterior orifice at the back of your mouth. So that's the palatopharyngeal folds. That's supposed to be a tonsil. So those are the folds. So as it goes round the corner, the tulip seals within the oropharynx only. All right. A laryngeal mask would have a tip in here, and so would an eye gel, and they would sit much lower. So it is in fact reasonable to say that a tulip sits exactly where an LMA and eye gel don't. So again, looking from a more cross-sectional view, there's your epiglottis tip. There's where your tulip sits in the oropharynx. Can you see? So it's through the whole of the back of your mouth. So that's your uvula and your palatopharyngeal folds. Your tonsils would be here. That is your tulip cuff. Notice that's a clear pathway in. Now, happily, laryngeal masks actually cause passive regurgitation in 25% of cases because they actually open that orifice, whereas Goodell's and tulips cause none because they don't. So here we go again. Now this is but this is a section through the head with the eyes looking into the paper. So the nose, that's the back of the nose looking into the paper. And so what you've got is a posterior view of the larynx. Now there's your epiglottis, and there's your trachea there, and there's the kind of fossa both sides. That's your tongue, and that's a posterior view. So you would be looking from this side out of the mouth. All right, so the eyes are pointing into the paper. So there's your tonsil, there's your tonsil, there's your palatopharyngeal folds, there's your uvula. Now when you put a tulip in, it just seats over there. This is the lower edge that just extends over the epiglottis, but at the top end is only just touching. So here's the front view of the mouth, the opposite of what you just saw. So the tube goes through the palatopharyngeal folds. There's your tonsil, there's your tonsil, there's your folds. That's an open mouth, and that's the tulip. So this black hole at the back of your mouth should be filled with tulip cuff. Now here's a section with the top of the head removed. So that's your lower jaw. There's your tongue, your tonsils here, tonsils here. There's the tip of the epiglottis around the corner. So the tulip goes round the corner between the palatopharyngeal folds, which would be like that, and the cuff fills that space. So here we've got a 3D version, no, not 3D, this is a 2D version of a tulip in situ. So there's your epiglottis, there's your esophagus, there's your oropharynx, right? So the tulip just fills your oropharynx, nowhere else. Now that's unique, no other device does that. Here's an eye gel by comparison. So it's got this little drain port into the esophagus. It's basically going round supra the glottic. So it's going round the glottis, round the epiglottis, and you can see that literally a tulip sits where an eye gel doesn't. So an eye gel is here and the tulip's above it. So here, let's go through the stage of inflation. You can see this is a deflated stage 1 uninflated tulip. Here's stage 2, stage 3, stage 4, stage 5, and here it is fully inflated. All right, so what it will do, it will slowly but surely inflate and displace the anatomy. Now, this is why tulips are good with difficult airway, because what you've got is basically a central tube that's held centrally by the cuff. So irrespective of what's going on around it, the tube's got maximum clearance. Now that's why the tube's kept central to the mouth. You can see that. But that's also why there's no obstruction or removal, because when it's in your throat and as you pull it out with the flexible tube, it straightens out, and the cuff is kept central all the way through. Now here's basically the full 5 sizes of tulips. All right, so you've got blue, yellow, green, orange, and red. Now here's what you've got on the chart. This chart is in every instructions for use, right? It's all printed on the tube. So blue is size 0, yellow size 1, green is size 2, orange is size 3, and red is size 4. Now these adult sizes are basically the same as adult Goodell's in the UK. So green, if you're using a green Goodell, use a green tulip. If you were going to use an orange Goodell, use an orange tulip. If you were going to use a red Goodell, use a red tulip. Now, as I said, each tulip, this is a zoom of this, has the correct inflation volume and pressure printed on it. All right, so blue ones are the smallest, they're size 0, pediatric 5 to 10 years of age. Their inflation volume is 30 mils. Notice it's printed there, size 0, 30 mil, 50 centimeters of pressure, right? Now, 50 centimeters of pressure, 40 millimeters of mercury. Note this, the inflation pressure does not change according to size, only the volume. So as you can see on this one, inflation volume is 40 mils. Again, you notice that the inflation pressure is still 40 and 50 centimeters of water. This is a size 2 green, 50 mils. Again, the inflation pressure remains 40 millimeters of mercury. Size 3, 60. Now notice this. 60 is pretty much the max you need. Okay, the next sizes tend to use, they stick to 60. You can overinflate it, but it's usually not necessary. So this is a size 3 and it's 60. Inflation pressure is still 40 millimeters of mercury. Now this is the step. It's still 60 for a size 4. Okay, because 60 is big enough. So you don't need to keep going. The tube itself needs to get larger rather than the volume of the cuff. But the inflation pressure is still 40 millimeters of mercury. Now, if you look at the inflation volumes, right, so it goes blue size 0 is 30. Then you've got yellow size 1 is 40. Then you've got size 2 green is 50. Then you've got size 3 orange is 60. And notice what I just said, size red is also 60. Now you can take that higher to about 80. But this is, you've got to keep that pressure the same. You've got to monitor the cuff pressure. Okay. Now, if you look at inflation pressures, okay, for a blue size 2, 50, right? 50 centimeters of water, 40 millimercury mercury. Notice the same for yellow, green, orange, and red. They're all the same. All right. So that is the pressure. That's the minimum and the recommended. So, but look, don't underdo it. Otherwise, you're not going to get a proper airway. It's not going to be seated. It's not going to ventilate properly. It's going to leak because it's designed to have an occlusive cuff that displaces, the anatomy. So it gives you a clear airway and seal. If you don't fully inflate it, it can't work. But equally, don't overdo it. And what I mean by that is if you overdo the pressures in a tulip, because it's behind the tongue, you can obstruct blood flow to the tongue. You could end up with a blue tongue. So you have to monitor the cuff pressures. That's why I've printed them on every tulip. So again, use a 60 ml syringe. Okay, don't use a 20 times 3. It may not work right because you jiggling around as it comes in. Because the 60 ml syringe adds centrality and symmetry. They're not the same thing. It makes it accurate and fast, and the fitment is perfect. But if a tulip leaks, here's the good news. Because it's just an inflatable cuff, all you do is inflate it some more until the leak stops. All right, but you've got to monitor the cuff pressure so you're not overdoing it. So because it's inflatable, it can actually accommodate a size above and below just by adjusting the volume of the inflation. That is possible. So if you're stuck, you can overinflate and monitor cuff pressure. But again, if you find yourself in an emergency, somebody's in bronchospasm or something like that, you can increase the inflation pressure of that cuff in order to ventilate and make sure you can ventilate. Now, clearly you're in some trouble there, and probably intubation is best, but you can intubate through a tulip. So get started, then tube through it. Again, monitor cuff pressure. So this is a Tulip Airway website. Any questions? Let us know.